Hello everyone, my name is Saroj Bhangare. Today's date is 16 June 2022. Today video topic is the MedDRA and WHO DD. So, what is the MedDRA? MedDRA is a medical dictionary regulatory activity. So the MedDRA is the terminology used to classify the adverse event information associated with the use of the biopharmaceutical and the other medicinal product. It is classify the adverse drug event data from the clinical trials, spontaneous adverse event report by the healthcare professional, patient and other from the source of the adverse drug event. So MedDRA was developed under the auspices of the International Council for the Harmonization of the technical requirement for the pharmaceutical for human use. So the activity of the MedDRA maintain and support service organization are overseen by the ICH MedDRA Management Committee, which is composed of the ICH parties, the medicine and the healthcare product regulatory agency, and the UK healthcare, Canada and the WHO as a observer. So MedDRA is a clinically validated international medical terminology used by the regulatory authority and the regulated biopharmaceutical industry. The terminology is used through the entire regulatory process from the pre-marketing and post-marketing and for data entry, retrieval, evolution and presentation. So where is MedDRA use? Regulatory authorities and industry database, individual case safety report and safety summaries, clinical study report, investigational brochure, core company safety information, marketing application and the publication and prescribing information. So MedDRA structure. First is a system organ class, second is a high level group term, third is a high level term, fourth is the preferred term and fifth is the lowest level term. So non-current term, the term that are no longer used in MedDRA are known as the non-current term. So highlight in red color and term that the misspelled and outdated. So MedDRA code. Each MedDRA term assigned in 8 digit numeric code starting with the 1. So the code is a non-expressive. The code can be fulfill data in various electronic submission type. The new term is assigned subsequently. So the multi-axial terminology. The multi-axial, the representation of the medical concept in multiple associates, allow the grouping by the different classification, allow the retrieval and presentation via different data set. All the PTs assigned in the primary associates determine which associate is represent a PT during the data output. Prevent the double counting and support standard presentation. So first is the system organ class. So an SOC is the highest level of the MedDRA hierarchy, which is provide the broadest concept for the data retrieval, and there are the total of 27 SOCs. Next is a high level group term. The HLDT is more general grouping category for the one or more related HLDT. So next is a high level term, and HLT is a general category, is more of the group of level than the coding term. So next is the preferred term. A PT is a single medical concept for the symptoms, sign, disease, diagnosis, therapeutic indication, investigation and surgical or the medical process. The next is a lowest level term. The LLT is the lowest level of terminology and the most closely present the reported term. The LLT therefore provide the maximum specificity. So next is a WHO Drug Dictionary. The WHO Drug Dictionary is the international classification of the medicine created by the WHO Program for International Drug Monitoring and managed by the UPSLA Monitoring Center. It is used by the pharmaceutical companies, clinical trial and organization, and the Drug Regulatory Authority for the identifying the drug name in spontaneous ADR reporting in the clinical trial. So use to code concomitant medication and the treatment drug. The WHO contained the data from the 1968 onward. The content today is originating most from the IMS and the National Drug Names Reference. No entry are deleted even though there are the withdrawal from the markets in all case reported might be coded with the product. So classification of the ATC. In this system, drugs are classified into the at the 5 different level. First is the ATC first level. The system has a 14 main anatomical main group. It has a 1 letter. Example: A for alimentary tract and metabolism. The ATC second level. It indicate the therapeutic group and the consist of the 2 digits. The ATC 3 level. It indicate the pharmacological subgroup and the consist of the first letter. ATC 4th level. It indicate chemical subgroup and the consist of the first letter. And ATC 5 level indicate the chemical and substance and the consist the 2 digits. So for example is the first is the warfarin. The ATC code of warfarin is the B01 AA03. B for the blood and blood forming organ. B10 is a antithrombotic agent. B01A is a antithrombotic agent, and B01AA is a vitamin K antagonist. So next example is the ATC code for the aspirin. So N02BA01. N for the nervous system. N02 is an analgesic, and N02B is the other analgesic and the antipyretic. So third example is omeprazole. Omeprazole ATC code is A02BC01. A for alimentary tract and metabolism. A02 is a drug for the acid related disorder. A02B is a drug for peptide ulcer, and A02BC is the proton pumping inhibitor. So this information about the WHO, DD and the MedDRA. Thank you.